Hello everyone, I'm Dr. Tajni. I hold a BTS degree and I've successfully cleared NEET PG. I pursued MDS in the field of oral pathology and microbiology. With a teaching experience of 2 years, I'm passionate about sharing my knowledge in dentistry and contributing to this. Now, let me take you through the course how we'll be teaching in oral pathology and oral medicine over here. Just let me share my screen. I hope my screen would be visible, right? So, in oral pathology, basically, it is the study and the diagnosis and the treatment of all the diseases that are related to our gums, teeth, and all around the oral and the paraoral structures, right? So over here, I have just distributed this whole section into 6 parts, as you can see. Now, in the first part, it deals all about disturbances of in the development and growth, right? What all disturbances are there in the growth of the jaws and or paranasal structures, right? So first would be developmental disturbances and of oral and paraoral structures. Then we'll have benign and malignant tumors of the oral cavity. Then we'll have tumors of salivary gland, and finally cysts and tumors of odontogenic origin. So all these will approximately take up to 30 classes or 30 hours, as you can see. Now there are 4 subheadings, right? Now out of 30 classes, maybe the first might take 6 hours each. I have given 6 times 4 is 24. 2 hours might take an extra because some of the topic might be extra, right? Then next topic, we have diseases of microbial origin. So this will include all the bacterial, viral, fungal infections, dental caries, diseases of pulp and periapical tissues, and the spread of oral infections. This also will contribute to 30 hours. So there are more number of topics. I'll try to reduce the time to 4 hours per topic, right? Third section is injuries and repair. Now in injuries and repair, we have physical and chemical injuries of the oral cavity, regressive alterations of the teeth, healing of oral wounds, how wounds are actually healed. So this will cover in 10 hours. Coming to the next topic, we have disturbances and metabolism and immunological diseases. So it will have oral aspects of metabolic disease, how our oral cavity can reflect what all metabolic diseases are there present in the human body. And then we'll have allergic and immunological diseases of the oral cavity. These both will combine to 8 hours. Then we have diseases of specific system, like the diseases of bones and joint, diseases of blood and blood forming organs, diseases of skin and nerves and muscles, right? So all these will contribute to 20 hours. Finally, at the end, we have forensic odontology. Now in forensic odontology, we'll be dealing how actually the oral structures, the oral cavity helps you to diagnose and help in the forensic department. So this is a short topic. We'll completing it just in 2 hours. So this is the whole outline of all the 100 hours that we'll be going to have. Okay, so today we'll be starting a very, very small topic of the first chapter, that is developmental disturbance in oral and paraoral structures. So when we talk about the development disturbances of the oral structure, first structure that is most common is teeth. So we'll see all the disturbances, developmental disturbances of teeth in today's topic. Right. So when we talk about developmental disturbances in teeth, we can subdivide these disturbances into 4 types. Okay. So first type we'll have is developmental disturbances in the size of the teeth. Then we can have in the shape of the teeth. Okay. Then in the number of the teeth, right? And then in the formation of the teeth. So these are the 4 types. In today's class, we'll try to complete developmental disturbance in the size of the teeth and the number of the teeth, right? So first we have developmental disturbance in the size of the teeth. That is, the size of the teeth would be somewhat abnormal than the normal size, right? So first in developmental disturbances, first we have is the microdontia. Now, as the word suggests, microdontia, that means over here the tooth would be smaller compared to the normal size, right? So this term is used to describe the teeth which are smaller than normal. Very clear point? Okay. Now there are three types of microdontia that are recognized. First one is true generalized microdontia, relatively generalized microdontia, and microdontia involving a single tooth, right? So let's see about what is true generalized microdontia. Now, as the term suggests, true generalized microdontia, that is, all the teeth would be smaller than the normal. Okay, that throughout your maxillary and the mandibular arch, you'll have all the teeth that are smaller than the normal shape, right? So it is usually seen in pituitary dwarfism. It is seen in a generalized condition of the body when the body is actually dwarfed, right? So it is seen in pituitary dwarfism. All the teeth are well formed. There'd be no problem in the shape or size, in the shape of the tooth and the number of the tooth. All the tooth would be well formed, well functioning, but there will be generalized small. That is, all the tooth would be smaller in size compared to the normal one. Clear? Right. Next, we have relatively generalized microdontia. Now, in relatively, as the word suggests, it is normal or slightly smaller than the normal teeth that are present in the jaws that are larger than the normal. Okay. So what happens in relatively generalized microdontia? Usually, the teeth is a little bit smaller, right? Not very small, but the nearby teeth is actually big. So that gives an illusion, or this makes it relatively small, right? So normal or slightly smaller than normal teeth that are present in the jaws that are larger than the normal. I hope it is clear. Right. Then finally, the last one is microdontia involving a single tooth, in which it's not generalized as in the case of this true generalized microdontia. Not all the teeth, a single tooth will be smaller in size. Now, most commonly affected tooth are maxillary lateral incisors and the third molars, right? So these are the two that are most commonly affected over here. Then the most common form of localized microdontia affects the lateral incisor. It is called as peg lateral incisor. Okay, it is usually seen in a condition with syphilis. Okay, now in peg lateral, the mesial and the distal surface converge or taper incisely, forming a peg shape. I hope you can see in the picture here, right? Both the incisal, both the lateral and the distal surface. The normal anatomy of the tooth, you can have it in this form, right? Just let me make it clear. If I want to draw the normal anatomy of the tooth, it will look like this, isn't it? This is how a normal lateral incisor should look, correct? But over here, the lateral and the mesial side, the mesial and the distal surface, they converge, okay? And it shows like a peg-like teeth, okay? The root of the teeth is shorter than the normal usual. Okay, so I hope it's clear what is microdontia. Microdontia is when the teeth are smaller in size. The three types, either it can be true generalized, relatively, or microdontia that involves just a single tooth, right? Next is macrodontia. Now, as the word suggests, macrodontia, that the teeth would be larger than the normal size, correct? Now, there are three types of macrodontia. Again, true generalized, relatively generalized, and macrodontia involving a single tooth. Now, in true generalized microdontia, all the teeth are larger in shape. It is seen in pituitary giantism. Microdontia was seen in pituitary dwarfism, right? And this is an extremely rare case. Now, in generalized, what happens? Again, it is normal or slightly larger than the normal teeth present in the small jaws, right? And macrodontia involving a single teeth, that is usually uncommon. Clear? Okay. This was about in the size of the tooth. Now we come to the shape of the tooth. Okay, now in shape of the tooth, first one we have is called as gemination. Now in gemination, what happens is there will be a tooth bud, right? Now that tooth bud will divide and will result in incomplete formation of two teeth. Okay, suppose this is a tooth bud, one is a tooth bud. It should form one teeth, correct? Now what happens? This tooth bud actually germinates, and because of this there is incomplete fusion of two teeth. Can you see it over here? Yes, so germination are anomalies which arise in an attempt at division of a single tooth germ. The single tooth germ only will divide and it will look like this. Got it? And this will result, in the formation of the tooth that is having an incompletely fused. Right. Can you see it? Correct? So that will result in incomplete formation of two teeth. Right? So clinical features, it is seen both in primary and permanent dentition, has a higher frequency in anterior and maxillary region. So usually the anterior teeth of the maxillary region are more affected. Now, incisors and canine are most commonly affected, and teeth demonstrate a pronounced labial or lingual groove. Can you see a lingual groove? Right? In the labial side, there will be a pronounced labial groove. This is a labial groove. Now, because there is an incomplete fusion and there are that results in formation of two teeth, so there will be a groove at the junction between the two teeth. Okay. Now, what is the clinical significance of it? So, germination can result in crowding, correct? Because there are two, at the place of one tooth, now there are two teeth, or delayed or ectopic eruption of the underlying permanent tooth, and hence have to be extracted in certain cases. Okay. Now the labial or the lingual groove are prone to develop caries. Hence, such fissure sealant should be used. So over here, obviously, it is a groove, right? And groove are more prone to caries. So over here, we can apply a fissure sealant so that there are less chances of caries, correct? Then we have fusion. Now in fusion, what happens? There are two separate tooth germ. Because of any trauma, they combine together and form a single teeth. So fused teeth arise due to union of two normally separated tooth germs. There were two simple tooth germs, right? Over here and over here. Now maybe because of pressure, trauma, these two tooth germs have fused together, right? Now fusion may be complete or incomplete. Right? The tooth may have separated or fused root canal. So the root canal that will be formed, it can be either separated or it can be a fused root canal. Affects both primary and permanent dentition, most commonly occurs in mandible. Okay, now this occurs more in mandible, right? The clinical significance, again, fusion results in spacing because there were two teeth, right? They were supposed to form at the two places, but because of fusion, these tooth has joined, so that will result in spacing. Now, labial and lingual grooves are more prone to developmental caries. Right? So we'll try to end it here. Next part, we'll see it in the next part of the video. I hope this part was clear. See you in next video. Good day.